The good life means feeling your best and looking your best. And there is a Valley company helping men and women do that. It's Aesthetic MD. Dr. Chubaty and Dr. Harolyn Gilles are with us to tell us about the MedSlim program. Welcome back to both of you. Let's talk about the MedSlim program, Dr. Chubaty.
Well, the MedSlim program is a totally inclusive program for body sculpting and weight loss. We do a hormone diet, then we follow that up with spot fat reduction, which you should have as you're losing weight. You should also have the other program to help tighten up your skin as it's going, because you've probably seen people that have lost a lot of weight, they have the saggy skin. So we provide after the weight loss, or in conjunction with it, a combination of three things: a low-level laser therapy, and injections to kill the fat cell, and then a whole body vibration exercise system. And Dr. Gilles can tell you about the first part of it.
Let's talk about that. We hear the word hormones as women, and we're all ears.
Well, hormones are important for men and women. This is a part of the bioidentical hormone replacement program that I studied, became certified in, and as I was doing the studying and the training for that, I came across this hormone diet, which incorporates several of the hormones that we need, not all of them, but several special, a combination of hormones that will tend to help the appetite suppress naturally, bioidentically, without drugs or chemicals, which will help the person to feel more energetic during the diet. And yet, it's a rapid weight loss diet employing a very low-calorie diet. This is the thing that makes it, the hormones actually help to increase the metabolism so that the body doesn't sense that low-calorie restriction as a low metabolic situation, so that they keep the weight off.
Is sustained. Now, you said rapid weight loss. Just how rapid?
We can actually see the weight loss of 40 pounds, up to 40 pounds in 40 days. Men, of course, are a lot faster than women, but in our women, we're seeing an average of 35 pounds in 40 days.
That is incredible.
Safely, medically supervised, and with a high metabolic rate.
You know, and there are still some areas of the body that sometimes you just get stuck. They won't go away, regardless of the weight loss. That's why the other aspects of your program are so important.
Correct. What we do is we have it's a brand new system to North America. It's called low-level laser therapy for fat loss. Studies have shown that when you apply this laser, after 8 minutes, 99% of the fat is released from the fat cell. Okay? Now, where this fat goes into called the interstitial space, the space between the cells. So then what we do is we put the person on a whole body vibration machine, or they can go jog outside if they want, but it's 110 degrees, it's pretty hard. For 10 minutes, that helps get that fat into the circulation, and we follow that up with injections of what I call lipotherapy, and those we know kill the fat cells. So you release the fat, you get the fat flowing, and you kill the cell.
And you kill the cells so that you're not going to regain in those areas again.
Correct.
Okay.
Isn't that just lovely?
You know, we have seen this vibrational exercise. We have this machine, and this is something that you own. Is that correct? That the person on the program, or can you rent it? To explain how that whole system works, because that's something you want to do frequently.
Well, when they come in for the laser therapy and the shots, they get the laser first, and the laser, it's a non-ablative laser. That means it's not a heat laser. It's not like getting a LASIK eye surgery or a facial reconstruction. It's a cold laser. You just put the probes on and the person lies there for 20 minutes. That releases the fat from the cell, then they get on the machine, okay? And then after that they get the shots. The shots will get maximum 4 times every 2 weeks. The machine they use for about 10 times with both machines, laser and the whole body vibration. If they want to follow up after that, if they've lost their weight, they have a choice, then they can come in 3 times a week to get the machine treatments on the whole body vibration, or they can purchase the machine.
Okay, so from start to finish, if a person is interested in a body change, and we're on your MedSlim program, how long will it take from start to finish to see a marked difference?
6 to 10 weeks.
Exactly.
6 to 10
amazing.
weeks. You can have a new sculpted body and safely have one. The whole body vibration itself not just helps you to, doesn't just help you to lose the circulatory system, it helps you to increase the circulatory system, it helps you to lose cellulite. That's exciting. So that when you're losing the fat, you're not just losing the deep fat, but you're losing cellulite. It increases the lymphatic circulation like crazy, so that people who have edema or swelling, like myself, have it go right away if after usage on a daily basis.
Well, I'm sure there are a lot of people with questions. Dr. Chubaty, Dr. Gilles, thank you so much, and you can get those questions answered just by contacting Aesthetic MD.
Welcome back. Dr. Roman Chubaty from Aesthetic MD joins us now with the news on a laser that promises to zap away fat. Sandra Price is actually the patient who had this procedure done. But first, let's start with you, Dr. Chubaty. What is this laser and how does it work?
Well, this laser, you have to differentiate between, there's two types of lasers. There's a hot laser, which is an example is that you do surgery with, LASIK surgery, or Star Wars, as we talked about, you know, that burns things. And there's cold laser, and the best example of that is a laser pointer. You know, you point something, the beam of light goes on. This is actually cold laser. There's no pain involved at all. You put like 2 paddles on the person's area that you want to focus on, and you set it for 10 minutes, and you leave the room. No pain, nothing.
Really? It's so you said it's like a piece of
well, there's material? 2 paddles you put on.
Paddles, okay.
Yeah, and they're connected to the machine, so it's not somebody standing over you with a beam of light. The light then is, and then you strap it in, and the light just goes in.
How does it work to get rid of the fat?
Well, what it does, it affects the circulation, and actually studies have been done on cold laser technology that after 8 minutes under an electron microscope, the fat is released from the fat cell. And then it goes into your lymphatic system. What we do is we combine that after 30 minutes on the laser. Either they go for a jog, or if you remember, we had that machine that vibrates you. We put them on that for 10 minutes.
Wow. Now, Sandra, you actually had this done.
Yes, I did.
And what did you think?
I loved it because it's no pain. I've lost about 1.5 inches around my waist, which is my worst area.
Every woman will admit that is the area we just, especially if you had kids, you can't lose that.
That's right.
We can lose it just about everywhere but the stomach area. We have some before and oh yeah, see, it's that little ledge that everyone has, and look at the difference.
That's about 1 or 2 treatments? That was pretty quick, wasn't it?
Yes.
Just 1 or 2?
Right.
And how long ago did you have that done?
Well, it's been a couple of months.
And have you noticed it coming back? Has it been gone, stayed away?
I'm still, wearing the same size, even though after going on vacation, putting on a few pounds, but I'm still wearing.
So, Dr. Chubaty, would it work for other parts of the body? Legs? A lot of people have problems with thighs and back of
Absolutely. And I combine that with, if you remember, I do the shots for the fat too. And it can either stand alone, or if they want, depending on the weight and how big a person is, that we can then follow up with the injections that actually kill the fat cell. This releases the fat, the shots kill the fat, so that would never come back then after that, the combination treatment.
Right. But this treatment, the fat will come back, correct?
Because we're only releasing the fat from the cell, we're not killing it.
Right.
A cold laser has been used prior to liposuction. The plastic surgeons have found using a cold laser, the liposuction is much easier because the fat is released from the cell. So instead of sucking the fat out, I can kill the fat cells with the injection.
Now what about, could this work on cellulite as well? It sounds like it's kind of the same.
Yes, it can.
Here's me going, does it work on that? Okay. Very good information, and that's great. I'm sure you were very happy.
Oh, yes, I loved it.
Yeah.
Loved it.
All right, especially this time of year when everyone's just got that little bit on their tummy and it's bikini season. This is when you want to lose that. Thank you very much for being here. Good to meet you. And if you would like more information about what we just talked about with this cold laser, just go to aestheticmd.com, or you can call the number you see right there on your screen, 480-538-9222. Thank you both again for being here.